Hello everyone, I am Michael Ruger. I am the managing partner of Greenbush Financial Group. The trustees of the Medicare program just released their 2022 report. And in this report, they kind of forecast out saying, here's the money's coming in, here's the benefits that are going out. The trust is going to be sufficiently funded until X date. And the dismal news in that report was they actually expect the Medicare Part A trust to become insolvent in 2028, which is just 6 years from the time that I'm actually making that video. And the problem with that is there are 63 million Americans that depend on Medicare for all their health insurance needs and retirement or that have disabilities. So the problem has been we've been kicking this can down the road for the last 40 years and now we're running out of road. In this video, I'm going to be covering what benefits does this Medicare Part A provide that are essentially at risk. You have to know the difference between the Medicare HI Trust and the Medicare SMI Trust, which is very important. Also, if Medicare goes insolvent in 2028, what happens? What does that look like? Changes that Congress could make to prevent the insolvency. And also at the end, I'm going to be discussing some action items that retirees can take to help manage that risk if in fact Medicare does become insolvent. The Medicare program is supported by two separate trusts, and Medicare itself has multiple pieces. You've got Medicare Part A, Part B, Part C, and Part D. There's a trust there just to support Part A, and there's a separate trust there to support B, C, and D, and I'm going to explain why that's important. We'll start off by looking at that Medicare Part A trust and services. So when you sign up for Medicare, Part A covers hospitalization, hospice care, skilled nursing facilities, and some home health services. And the trust that supports that is called the Hospital Insurance Trust, or HI Trust. And that is the trust we're talking about here that they've highlighted in the report, saying that is the trust that is at risk of going insolvent in 2028. The primary funding vehicle of this HI Trust is that 2.9% payroll tax that's assessed that is split between employees and employers, which is really the inflows and funding vehicle for that trust. And similar to other government programs, there's just been more outflows than inflows for a number of years, and finally the numbers have caught up with it. Switching gears over to the other trust, which is called the SMI Trust, which stands for Supplement Medical Insurance Trust. That is the trust that backs Part B, Part C, and Part D. Medicare Part B covers your doctor's visits, outpatient services, and preventative services. Part C is your Medicare Advantage programs, and Part D is your prescription drug coverage. Even though there's a separate SMI trust that supports Medicare Part B, C, and D, those programs are less likely to run into insolvency issues because they're funded primarily by the general tax revenues of the federal government as well as premiums paid by the end beneficiaries. The most recent report I saw was about 73% of the funding for Part B in 2021 came from just general tax revenues. Same thing, Part D was about 74% of general tax revenues were used to support that program. So a trust is only a piece of that. And also they can pass along the increased cost because when you look at Part B and Part D, there are premiums charged to retirees that are deducted from their Social Security, and they can always increase those premiums, which they did in 22. Between 21 and 22, those premiums increased by about 14%. Part C of Medicare is slightly unique because this is the Medicare Advantage programs. That program is supported by actually both trusts, the HI Trust and the SMI Trust. And also, depending on the plan you pick, it could also be supported by premiums from the policyholder. The big question is, if we get to 2028 and Medicare Part A does in fact go insolvent, what does that look like? What does that mean for retirees? So based on the trustees' projections, it doesn't mean Part A completely implodes and there's nothing there, but based on the money they expect to have in the trust, it would only be enough to support about 90% of the promised benefits. This essentially means that Medicare might have to reduce the amount of reimbursements immediately that they're giving to the hospitals, the skilled nursing facilities. So they were expecting to get full reimbursement for these Medicare Part A services, and now they're only getting 90% of that. And that obviously has some blowback effects. The hospitals might have to reduce costs, cut staff. Some practices might even decide to say, we're not accepting Medicare anymore, no more Medicare patients, because we can't get an adequate reimbursement to reimburse ourselves for the actual cost of providing the services. So this is how it could start to play out in the real world if this were to happen. Now we're going to transition over to talking about some of the solutions you might see coming out of Congress to help fix this insolvency problem before we arrive in 2028. Now, the reason why they probably haven't suggested anything yet, even though we've known this has been coming, is it's a political football. Like, if you have an insolvency issue with a government program, there's really only two ways to fix it. Either you increase taxes or you have to cut spending. As a politician, either option you choose, you're probably going to tick off a large portion of the voting population because you're either raising taxes on someone or you're taking some benefits away. So it's a very politically sensitive issue. But the reality is, the longer they wait, instead of acting now, if they wait until we're on the doorstep of this problem, the solutions unfortunately have to be bigger and usually more painful. Small changes can go a long ways if they're done in advance. I was reading one report that basically projected that if they just increased the Medicare tax from like 2.9 to 3.6, it was projected that it would bump out the insolvency by another 75 years. Or if they cut expenses by about 15% starting this year, that would have a similar effect. Another solution you may see is they might restructure the Medicare system. Since A is having the problem, if they move some of the A services down to the B category, that could give more breathing room for the Part A trust, but it's just really a cost sharing that by moving those services down to Part B, now it's being paid more from the general tax liabilities of the government or from premiums passed on to the actual beneficiaries. A third solution, which you're starting to see that from the legislation that just passed, is Congress could give Medicare more power to negotiate how much they reimburse for services and prescription drugs in an effort to lower their overall cost. But again, like we talked about before, there's the backside of that where if you're putting a lot of pressure on health service providers, it could put pressure on them financially or decrease the quality of care. So you just got to be careful. The fourth solution, which I believe is probably the most likely to occur, is we'll get all the way to 2028, we'll be staring the insolvency in the face, and the government will have to authorize an emergency bailout package for the Part A trust to keep it going and buy themselves more time to create a longer-term solution. But to proactively prepare, you have to ask yourself, even though that may be the most probable outcome, what if they can't print more debt by the time we reach 2028 to essentially bail out the system? What if costs do go up or benefits do get cut? How are you going to deal with that individually within your overall financial plan? Because the Medicare Trust isn't the only one that's facing insolvency. You've heard about the Social Security Trust, one of the PBGC trusts that actually provides pension benefits for all these defunct pension plans. That's facing insolvency. So this is not the only government program that's going to need money. So when we consult with retirees, we say, hey, this is a real risk. We don't know exactly what the solution is going to be, so you should build some cash cushion into your retirement annual budget to say if for some reason you have to pay substantially more for your health care a few years down the road, you've already prepared for that. I hope this was helpful. If you have any questions, please feel free to reach out to me at moneysmartboard.com. Thank you.